We have already discussed the vaginal changes after a natural childbirth. Today, I, Dr. Sudeshna Ray, will discuss about the care that you need to take of your vagina after a natural childbirth or after a normal delivery. 1. Taking care of the vaginal soreness. Now, your vagina might feel a little bruised or a little sore after you have given birth to a baby naturally. You might also have a small cut to help the baby come out. You can do the following to relieve you from the vaginal soreness. 1. Sit on a comfortable, soft, padded pillow or a ring. This will prevent the sore area or the bruised area to be in direct contact with the sitting surface and thus help to heal the area better. 2. You can also choose to keep a flat, cool ice gel pack, not a rigid one, a soft one, in between the sanitary napkin and the perineum. Well, perineum is the space between the vaginal opening and the anal opening. Keeping a cool ice gel flat pack there relieves you significantly from the soreness. 3. When you go to pass urine, you can have a very gentle spray of lukewarm water or even cold water on that area. This will not only clean that area but make you also feel a lot more comfortable. 4. Sit on a warm bath, like a warm water with antibiotic solution at least twice a day. A good 10 minutes sit. The water level should be deep enough so that your buttocks are under the water. The water should be lukewarm and not very hot. And as I said, a good 10 minutes sit is a great relief to the sore area. 5. Please do not forget to take the painkillers, to take the antibiotics and the stool softeners that has been advised by your doctor. Taking care of the vaginal discharge. Now, the vaginal discharge after a childbirth is called a lochia. It starts with a red discharge, then it becomes a little pink, then it becomes brown, and then it becomes white and usually goes off in 6 weeks. It also has an unpleasant odor, but please do not use any perfumed spray or any perfumed soap or any other cosmetics down there to prevent the smell or to take care of the smell. You can use a room freshener or you can use the aromatic candle in the room as an alternative. If you feel that the discharge is very heavy or it has suddenly become red or it's foul smelling or you are having fever, please speak to your doctor immediately. Taking care of the vaginal dryness. Your vagina might be a little temporarily dry because of the soreness or because of the hormonal upsurges or hormonal changes. This vaginal dryness actually remains till you're breastfeeding. As soon as you stop breastfeeding, the hormones come back to normal and your dryness gets relieved. If you still feel dry while having sex, a water-based lubricant is a good idea to use. Please remember that you can resume sex only after 6 weeks of delivery at least. Taking care of the vaginal looseness or laxity. The vagina might feel a little open or a little loose soon after the delivery, but it is an elastic organ. It regains its tone and tightness soon after the delivery, slowly, gradually, and within 6 weeks it's completely almost back to the normal. At times you can you can always help yourself by doing the pelvic floor exercises and by doing Kegels exercises or specific postnatal exercises. Only if you had a very hard childbirth, vaginal childbirth, and if there is a big cut or there are injuries in the muscles and the vagina has lost its tone and it has not gained its control, only then you will need a specific targeted physiotherapy. Taking care of the incontinence. Now, you might feel a little less controlled over peeing or over pooping or even passing gases soon after the childbirth. Now, this is very normal and this usually settles down within the first 3 months. If only beyond 3 months you're feeling that you're still have not gained control on the muscles, or still not gained control over the urination or over your passing of gases or passing of stools, you will definitely need a specific dedicated physiotherapy under an expert guidance. A good regain of your vaginal health also depends on how you have taken care of it during the pregnancy. So start early and do not wait for the childbirth to start taking care of your vagina.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.